Hi, my name is Hannah Pasternak. I'm a licensed clinical social worker in the state of California, and I work for Lisa Eaton Therapy and Coaching. And I wanted to jump on here today to talk a little bit about what therapy is like and answer any questions, debunk any thoughts or theories or fears of why therapy is scary or is hard to begin. So let me just first say that I think it is such a strength recognizing that additional assistance and support is needed. There's a lot of stigma about seeking out mental health care that has come from generations and generations ago, and even sometimes within ourselves. And so let me be the first one to say, I don't want to make it a scary experience for you. The goal for me is to, talk openly with my clients about where they are having challenges and struggles, as well as where things are going well. A lot of times we don't have to um, create a whole new story. We can really tweak the things that are already working well for you and add on and bolster the skills that you have. What a typical therapy session looks like for me is I like to check in about what's just been going on in the week, things like triggers, difficult moments, whether it's utilizing coping skills, irrational thoughts, um, you know, hard interpersonal interactions. I like to talk it through. And then, of course, it's my job to tie it back into the goals of what do you want to work on in therapy? Which areas do you want to explore about yourself? For some, they just need that, non-biased person to talk to, and I'm totally here for that. Some need more guidance and connecting to childhood moments or moments in trauma that they have experienced. And so we can really adjust and adapt to whatever is needed. I'm very homework oriented and goal oriented. So I like to create a game plan for what does this week look like? Because I only get an hour a week or every other week with you. I want the rest of your time spent in your week to be really intentional. The other thing about me that you should know is I operate from a trauma informed care uh, framework. And so, what this means is I acknowledge that a lot of us have experienced trauma, whether it's what we call big T trauma, which is, what we can imagine things is that we see in movies like war or car accidents or surviving a natural disaster, abuse, sexual assault, things like that. But there's also little T traumas as well, difficult interpersonal relationships, emotional abuse, neglect, financial difficulties, living in poverty. And so I like to operate from a trauma informed mindset, keeping all of this in mind for me. I never like to assume about my clients. It's really my job to learn about how your brain and how your world operates. And I never want to re traumatize or cause harm as well. So I always like to operate from a standpoint of curiosity and interest and not assuming that I'm the expert in the room. And I found that that's what works best for my clients. So, this is just a little bit about me and what a therapy session is like with me. And you get to see a little bit of who I am. He's not here right now, but usually my dog is my fellow assistant. And it's nice to see kind of a warm and cuddly little guy in the back. And so I'd really love to work with you, and please feel free to reach out. And I'm looking forward to hearing from you. Thank you. Bye.